Okay, this is speech number 2 using Monroe's motivated sequence. Please pan the audience.
Give him a good side.
Yeah.
And recorder, go ahead and pan yourself, please.
It's liable to break it.
Okay. Okay. So, the second speech that I'm about to give here is a continuation of cystic fibrosis and ways that you can support the Cystic Fibrosis Foundation. For cystic fibrosis and their foundation, I might abbreviate that CF or CFF, so you all know what I'm talking about. Okay. Imagine trying to take a deep breath while someone has their hands around your neck, squeezing tightly. Would this situation trigger a panic response inside you? For a patient diagnosed with CF, the respiratory complications associated with being unable to clear thick, sticky mucus out of your lungs and airways include the scenario I've just described. As one of the 30,000 patients in the United States diagnosed with CF, you might accept that your disease is incurable and resign yourself to die before the age of 40. As the average lifespan of a CF patient is only 37 years in the United States and even less in some other less developed countries. If you're diagnosed with cancer, you may stand a good chance of your disease going into remission and continuing to lead a normal life. But there is no remission from CF. It is permanent. As a genetic disease, it cannot be prevented and will surely follow you for the rest of your days. What if there was a way to change all that? What if advances in genetic research and engineering could cure this disease? Recent developments indicate this is now a real possibility, with at least one drug receiving FDA approval to combat CF on a genetic level. None of these developments would be possible without the Cystic Fibrosis Foundation. In 1989, scientists working for the foundation discovered the gene sequence mutation that causes CF, and today they remain on the front lines in the fight to find a CF cure. As a respiratory therapist in training, I can expect to deal directly with people affected by CF. It's nice to provide symptomatic care to these patients to manage their symptoms, and also I can perform physical therapy to ease the constant stress of having CF with their retained secretions. But someday I would like to tell them that their disease is curable and that there is no reason why they couldn't live well into their 70s and beyond. Curing CF sounds like a very specialized goal, and it is. But due to its genetic nature, advances in the fight against it can have important implications for the treatment of other incurable diseases, including many types of cancers and congenital birth defects. Even if CF hasn't touched you or someone in your family directly, the benefits of researching and developing a cure for it extend to those people with other intractable diseases that may have a genetic or hereditary link. It is through the donations of time and money by people like you that the CF Foundation's research can be allowed to continue. Today, I would like to paint a picture of the nature of CF and how you can assist the CF Foundation in fighting it. Cystic fibrosis is an incurable genetic disease that affects the respiratory, endocrine, and digestive systems. It is fatal. About 1,000 new cases are diagnosed each year, according to the CF Foundation's webpage. 70% of patients are diagnosed by age 2, and there is a simple test to use as diagnostic criteria for the disease. It's the sweat chloride test. Normal sweat chloride amount is less than 60 milliequivalents per liter. So if you have greater than that amount, it is it is almost 100% that you have CF. I mean, it's the main diagnostic tool. And it's cheap, so most people know they have CF by the age of 2. Over 45% of the CF population is at least 18 years old, but the average lifespan of a CF patient is less than 40 years. Treatment for CF is mostly symptomatic and includes inhaled bronchodilators to open the airways inhaled and oral antibiotics to combat infection caused by stagnant bacteria-laden mucus in the lungs, and mucolytic medications that thin the thick, sticky secretions that are typical of CF. Genetic research is crucial to understanding CF and finding its cure. In 1989, the defective gene that causes CF was discovered by scientists who were affiliated with the CF Foundation. Gene therapy will be instrumental in finding a cure for CF. Gene therapy involves adding a corrected gene to a patient's genomic profile to treat diseases. It involves the use of a vector or a virus to implant the new gene into the body, usually through an injection. And this triggers the synthesis of RNA and other proteins that carry out the functions of the healthy gene. This synopsis I just gave you was based on some information from Utah University's Genetic Science Learning Center. Actually, a popular movie, The Bourne Legacy, kind of popularizes how superhumans can be made through gene therapy, and they talk about one of their agents viraling out to get out of the program, and it's because they're using a virus as a vector to create all these changes in the body. As I mentioned in my last speech, in 2012, a drug called Kalydeco was approved by the FDA to treat a specific subset of cystic fibrosis. This subset involves a unique gene mutation that accounts for between 4 to 5% of the entire CF patient population, according to Kalydeco's webpage. It is effective in treating this particular subset of CF on a genetic level. It does not cure the disease, but it helps the body to work more normally. But it is very expensive. It averages $311,000 a year for treatment for one patient.
Wow, goodness.
Continued donations are needed to advance research toward an economical cure for CF. There have been many significant developments in the fight against CF over the past 30 years, but there's still much work to be done. If CF were one day cured through advances in gene therapy, 30,000 people in the United States would live potentially longer, healthier lives. A cure for CF would be a breakthrough for researchers focusing on treatments and cures for other diseases, including several types of cancers, diabetes, neurodegenerative diseases like Alzheimer's, and viral infections including HIV and hepatitis. Finding a cure for CF would accelerate the process of moving gene therapy from a research setting to a clinical setting. So today there is hope for people who have been diagnosed with CF. Cystic fibrosis remains a deadly and incurable disease, but significant progress in the fight against it has been made thanks in large part to research funded by the Cystic Fibrosis Foundation, and their research was made possible through donations made by people like you. Genetic research and gene therapy remains critical to the understanding of the nuances of CF. A cure for CF would immediately benefit people affected with it, but would also be a milestone for gene therapy as a whole. If you'd like, you can visit cff.org/getinvolved to make a one-time or monthly donation. Thank you very much.
I think Bella